Good afternoon, and thank you for joining us for today's COVID-19 community conversation. We value your time during this public health crisis. As we respond to the COVID-19 pandemic, UMS is hosting these webinars to ensure that our communities are fully up to date on our forward stance against the virus, as well as steps that you can take to combat COVID-19 in your daily lives. Today's speaker will be Donna Jacobs, Senior Vice President of Government, Regulatory Affairs, and Community Health. Donna has a long career of service in Maryland dedicated to healthcare policy issues and has played a critical role in our COVID-19 response, coordinating community health programs and developing outreach strategies related to mental health. Donna will be addressing today several topics, including how you can evaluate COVID-19 risks this summer and what steps you and your family can take to stay healthy. Today's presentation will lay out several guiding principles to consider in any situation, as well as specific tips for common scenarios, such as dining out, visiting loved ones, or hosting backyard barbecues. I will now give Donna the floor to share with you these everyday precautions and practical tips. Donna?
Thank you, Chris, and good afternoon, everyone, and thank you all for joining us today. Fortunately, Maryland has been reporting encouraging numbers as the number of hospitalizations and the percentage of positive test results are trending downwards. That's great news. Much of the state is now in stage 2 of the Maryland Strong Roadmap to Recovery. But we have to remember that even as these numbers improve, there is still some risk. Lower risk does not mean no risk. As a state, we've lost more than 3,000 Marylanders to this disease over these last few months. And each death is one death too many. Each death means that someone has lost a mother, father, brother, sister, son, daughter, or a friend. As we continue to move forward towards Maryland's recovery, we each still have a role to play to stop the spread of COVID-19. And yes, that includes both you and me. That means every one of us. Summer is in full swing now, and I know that many of you are anxious, as am I, to enjoy activities with families and friends. But we have to do so safely and in a way that reduces any potential transmission of COVID-19. We can't determine your individual risks precisely or predict all of the outcomes of each possible scenario, but we can give you a good idea of what we understand right now about the transmission of COVID-19 and discuss risks to consider in some common summer settings. Before we dive into specific potential scenarios, let's talk a little bit about some general guiding principles for any gatherings or participation in activities outside of your home. According to the Centers for Disease Control, which I'll also call the CDC, in general, the more closely you interact with others and the longer that interaction, the higher the risk of COVID-19 spread. That bears repeating. The more closely you interact with others and the longer that interaction, the higher the risk of COVID-19 spread. Therefore, it continues that the safest course of action remains to stay at home as much as is possible. But other do's and don'ts include the following. Do wear a mask when in public, because the virus is most often transmitted by airborne droplets. Wearing a mask is especially important when it's difficult to maintain social distances, which are required in Maryland when in grocery stores and other indoor public spaces. Do practice social distancing by leaving at least 6 feet of space between you and others, especially when you're indoors. Remember, the longer you're in close contact with other people, the higher the risk of exposure. This is especially true if you're in close contact with someone who sneezes or coughs without a face covering. Do continue to limit the number of people that you spend time with. Expanding your circle outside of your household raises your risk. And do follow local rules and regulations. Different jurisdictions may have different rules on the maximum number of people who can gather, the dates when businesses are allowed to reopen, and the like. So be sure to check local regulations, especially if you are traveling. Consider your risks and the risks of your loved ones. New CDC data show that those with underlying medical conditions are 6 times more likely to be hospitalized with COVID-19 compared to otherwise healthy people who contract the virus. The don'ts. Do not visit or interact with others if you are sick. Be mindful of how you're feeling and self-quarantine if you're experiencing any symptoms of COVID-19, including fever, shortness of breath, cough, fatigue, headache, muscle or body aches, or the loss of taste or smell. I think at this point we now know those symptoms. They bear repeating. And don't visit crowded locations or areas where masking or physical distancing recommendations are not being followed. One of the best things you can do to protect yourself, and importantly others, is to wear a face mask. People who have COVID-19, some people who have COVID-19 are asymptomatic, meaning they have no symptoms at all. But those who are asymptomatic may still be contagious. So you could have the virus without knowing it and potentially, unintentionally infect others. Wearing a cloth face mask can greatly reduce the risk that you may transmit the virus to others without knowing it. Also, it's important to know that some people may be very infectious in the days before COVID-19 symptoms appear. Thus, the risk of transmission to someone else is greater, but no one has a warning of such. The CDC recommends that everyone wear a homemade mask when in public. You do not need a hospital-grade mask. And as I mentioned before, it is required in Maryland inside retail establishments. In fact, at UMS, University of Maryland Medical System, everyone inside our facilities is required to wear a mask at all times. There are some exceptions to the CDC's recommendation about wearing a mask. For instance, children under 2, those with breathing problems, or those who cannot wear a mask, remove their mask rather, if worn without assistance, may not want to have one at all. And again, you don't need a medical-grade mask. A simple cloth or homemade mask that covers both your nose and your mouth will work just fine. You can find more information on masking and find links for instructions on making a homemade mask at ums.org/homemade mask. Very simple. Terrence Nelson, one of our respiratory therapists at the University of Maryland Capital Region Health, recently documented many of our UMS colleagues wearing masks during his breaks in between caring for COVID-19 patients. Those photos reinforce the importance of wearing masks whenever possible in order to protect each other, including our healthcare heroes. We also recently asked people at UMS to share with us why they believe everyone should wear a mask. And I wanted to share with you some of those heartfelt answers. One said, "There's a lot about COVID-19 that is out of our control. Wearing a mask is one of the simplest and easiest ways we can prevent the spread." Someone else said, "It's an issue of respect for our own lives and for those of our fellow mankind." Another, "We must work as a team to protect our vulnerable loved ones and keep the number of COVID infections low until we can find a vaccine. We don't want to risk overburdening our hospital system." And then a last one here is wearing a mask means that we can safely get through this pandemic together. And that's right, we are all in this together. Keeping the guiding principles that we've just outlined at the beginning of this presentation in mind, and the importance of wearing masks, keep that in mind. But let's shift to discuss some particular summer scenarios. These are tips for the best methods to try to stay safe while visiting grandparents, other family members or friends, going out to a restaurant, barbecuing in the backyard, swimming in a pool or the beach, actually, too, summer travel, attending church, and going to the hospital or to see your doctor. Father's Day is Sunday, so we know many people are considering whether they should visit parents, grandparents, or other loved ones. An important thing to keep in mind is that older adults and older relatives can be more vulnerable to this disease. However, if you do visit family, it's best to have short visits with everyone wearing masks and maintain your physical distances. Unfortunately, we know that means no hugging and kissing. Short visits also decrease your risk of being infected, but more importantly, decrease the risk of your loved ones becoming infected if you do have COVID-19 and you don't know it. Dr. Daniel Morgan, a professor of epidemiology and public health and infectious disease at the University of Maryland School of Medicine, emphasizes that bars and restaurants are among the most difficult places to practice social, or as we call it, physical distancing. So he recommends those at high risk avoid bars and restaurants completely until the virus is no longer a risk. For that reason, if you're looking for a meal out, many restaurants are still offering contactless delivery or pickup options. These are indeed the safest restaurant options for you and your family. Maryland restaurants do now have the option to offer outdoor and indoor dining at 50% capacity. Know that you can call ahead and ask the restaurant about the COVID-19 safety guidelines the restaurant has put in place, such as whether their staff are wearing masks and whether there's ample room for social distancing between dining tables. We recommend, however, opting for outdoor seating over indoor dining if it is available, as the open air and increased ventilation are more likely to reduce the virus transmission. We also recommend that you either wash your hands or use a hand sanitizer when you enter the restaurant and when you exit, whether you're outside or inside. Barbecuing. This is one of my favorite things and one of the things I had the most angst about with COVID-19. If you're planning on hosting a barbecue backyard or some similar gathering this summer, we recommend limiting it to your household members or others that you already have interacted with within your sphere. Host your events outside, outdoors when you can, abiding by all local regulations on the amount of people that are allowed to gather, and make sure there's plenty of room for physical distancing. The more, the better. Of course, ask guests who may be sick or who have been exposed to someone who is sick to stay home, and gently remind your guests no handshakes or hugs. Ensure that everyone is wearing a mask and make hand sanitizer available or a way for people to wash their hands. Limit gathering around the grill and encourage your guests to bring their own food and drink if possible. That will cut down on the risk of spread. If you are serving food, consider identifying just one person to serve all of the food so multiple people are not handling the serving utensils. The CDC also recommends that you consider keeping a list of all of your guests who have attended your event should someone become sick in the future and you need to go back and contact trace. You need to go back and identify the people that were present in order to help them stay safe and help them help their families remain safe. Another mainstay of the summer is, of course, swimming. and the swimming pools. Is it safe to swim? The pool itself is a low risk. There's no evidence that COVID-19 can be transmitted through the water in a swimming pool. But swimming pools are often also the common gathering places for people where it can be difficult to maintain social distances, or where people forget to wear a mask in close proximity. There are also loads of high-touch surfaces, such as changing rooms, where the spread of virus can be increased. We recommend waiting until we have a better understanding of COVID-19 virus before you use a public swimming pool. In a private pool, we recommend maintaining social distances appropriately, 6 feet or more, from anyone who is not part of your household. And we also recommend showering with soap once you exit the pool. The same rules apply generally to swimming at the beach. The risk lies in the community gathering and the crowds at the beach, so avoid busy beaches or, for that matter, parks. Summer also means vacation for a lot of people, and there are a number of considerations to keep in mind if you plan to travel this summer. It's heartbreaking to think that we won't. Consider your mode of travel. All travel carries some risk and will bring increased opportunities to contract or spread COVID-19. If you're traveling by car, depending on the length of your trip, of course, it may require multiple stops along the way at gas stations or to get refreshments. Flying requires you to share close quarters with people outside of your household, and it can be difficult, if not impossible, to maintain social distances. It also requires you to touch a lot of shared surfaces, so clearly flying imposes higher risks. Either way, whether by car or by flight, try to anticipate your travel needs and ensure that you have a mask, food, and medicine that may be necessary, and supplies to clean your hands and disinfect shared surfaces along your route. Same applies if you're going to a hotel room or Airbnb or the like. Again, you also want to look into the local regulations at your destination. For instance, will your destination require you, or when you return home, will you be required to quarantine once you arrive? Troublesome are cruises, including river cruises, and these are not recommended. You may want to consider canceling or rescheduling these kinds of travel until the threat of COVID-19 has firmly passed. Cruises, as we have seen from the media, pose a very high risk of the transmission of COVID-19. Attending churches. Of course, our faith communities are really important to many of us, especially during this incredibly uncertain and stressful time. Many churches are still offering online streaming for their services, even as we begin to go back into in-person worship. I'd encourage you to take advantage of the online streaming if you can, whenever possible. Some churches are offering outdoor services which have a lower risk of COVID-19 transmission, just as with restaurants, than would indoor services. If you do attend in-person services, practice strict social distancing. Don't shake hands, and when the right hand of fellowship is extended to you, do not hug. Also, try to avoid touching or using common objects. Bring your own pen, your own Bible, or your own other religious text. It is absolutely critical that you wear a mask, as there's evidence that singing can increase the rate of the viral transmission. Lastly, one of the questions that we receive a lot is whether it's safe to go to the hospital or see a doctor. Yes, it is safe. Throughout this crisis, the University of Maryland Medical System, for instance, has not only remained open for care, but we've also put in place new ways to provide convenient health care by dramatically expanding the telehealth services that we offer our patients. And we're proud to say that we've been able to offer telehealth to tens of thousands of Marylanders in order to meet their health care needs, and also give patients the flexibility and peace of mind of being able to stay in contact with their medical provider. But we've also put in place specific measures to further ensure that our facilities remain safe for you during this pandemic. So let me say it again, UMS is a safe place for medical care. This is incredibly important because many Marylanders are becoming seriously ill because they've decided to put off doctor visits due to fear of COVID-19, and in some cases have refrained from seeking emergency care when they needed it. If you delay treatment, a minor problem now can quickly turn into a major problem, so don't delay. It's also critical that you do not avoid medical care for your children or delay their vaccinations due to your concern about COVID-19. Those delays can lead to more serious diseases in the future, something we want to avoid at all costs. You know your body and your health. You know your children and their health. So don't be afraid to call your physician or come to the emergency department if you know that something is wrong. There's also been questions about testing. If you've been participating in large gatherings such as the recent demonstrations and protests, and we certainly understand why you would, or if you've otherwise been exposed to COVID-19, you should get tested for the disease. Testing is more readily available now, and it's also key to identifying those who are sick and helping us recover in the state safely. As the capacity for testing expands, people with coronavirus symptoms, and in some cases those with no symptoms, can be tested for active COVID-19 disease. Fortunately, there are now more than 150 major COVID-19 testing sites across the state. They offer a wide range of testing options, wide array of testing options. Some require a doctor's referral, others do not. Some require appointments. Some allow you to drive through, such as the VEEP stations, and others allow you to simply walk up and be tested. And then others are in a hospital or other office facilities. You can get information on these different testing facilities and options and find a location by visiting ums.org/coronavirus/test. ums.org/coronavirus/test. While I hope today's webinar has been informative, we know that there's an overwhelming amount of information and some disinformation in the public domain regarding the prevention and spread of the COVID-19 virus. UMS wants to continue to be a resource to you and a place where you know you can find trusted, reliable, and current information on the COVID-19 virus. So we have a website that can be found at ums.org/COVID. Quite of information there, including treating illness at home, general suggestions on managing your health and wellness also. It also includes topics like dealing with financial stress and provides links and phone numbers for you to connect to for various resources, including crisis hotlines. We also have a nurse call line that if you're on the screen, you can see. You can call there 24/7, 24 hours a day, 7 days a week. And that line is 888-713-0711, and it is staffed by nurses. Just as important as caring for your physical health, as we've discussed, is caring for your mental health. And that's especially so during this stressful time. UMS has hosted a series of additional community webinars through our Not All Wounds Are Visible series, focused on having an open conversation about mental health and COVID-19. The webinars have covered topics such as how to manage your stress, helping your children cope with COVID-19, and how to stay connected while social distancing. This week, we hosted a two-part webinar series to discuss mental health, racism, and racial trauma in our communities, given all that we've seen over the last few weeks in the media. And we thought this was especially important on top of what we're experiencing with COVID-19. All of these webinars can be found at ums.org/notallwounds. And I encourage you to go and look at those. Every one of those has been really excellent. Great speakers, great information.
Thank you very much, Donna, and thanks to all of you for joining us today. We hope that you will stay connected. You can find our social media channels displayed on the screen, and we hope that you will sign up for emails at ums.org/email. Also wanted to remind you about the UMS COVID-19 response website, which is ums.org/COVID, as well as our nurse call line, which is 1-888-713-0711. We are grateful for everything you are doing to keep yourself, your loved ones, and your community safe. So on behalf of Donna, thank you again for joining us, and have a great weekend.